Hi and welcome to EHI TV, eHealth Insider's essential news on video. I'm Shana Crispin, and this week we're taking a look at how NHS Direct is effectively reinventing itself as the government plans to introduce its NHS 111 service. NHS Direct published its business case for the next 5 years about a month ago. In it said its main challenge was how to convert from being a monopoly provider of the NHS Direct helpline to being one in a number of providers all vying for the NHS 111 service contracts. Chief Operating Officer Ronnette Lucraft is with me today to discuss the challenges NHS Direct faces and how it's using digital technologies to bring cost efficiencies. Firstly, Ronnette, can you give me some sort of idea about why you think the government decided to introduce the NHS 111 service to start with?
Well, obviously I can't speak on behalf of the Department of Health, but having been involved in the 111 service since it was called the 3-digit number project, which was a few years ago, I understand that what the government was told is that patients found it difficult to understand which number they should call in order to get access to urgent care, because there were a variety of places that they could go.
Okay, so how does that differ from what NHS Direct has been offering?
Well, we're part of the equation really, so we are a service which is available via multiple channels, 24 hours a day, 7 days a week. And what we offer is the ability for patients to understand what they should do next. And some of the time, what they should do next is they need an ambulance. And what we've needed to do in the past is to phone the ambulance service, often on behalf of the patient, and call the ambulance, and then the ambulance service then takes over the care of that patient and gets the ambulance there to them. In a 111 world, what's happening in the pilots is that after the assessment, if we determine that the patient needs an ambulance, we can dispatch the ambulance automatically without the patient needing to speak to anybody else.
So you're involved in all 4 pilots that are going on at the moment. Can you give us some insight as to how they're going and what lessons are being learnt so far?
Well, we are involved in all 4 pilots to a greater or lesser extent. So what's going really well is that we're dealing within the service levels, so we're answering the calls when we need to. We're getting very good patient satisfaction and very good feedback about the service, that patients like it. And what we're doing is learning about how we 3 organisations, the out-of-hours provider, NHS Direct and the Ambulance Trust, can best work together using a common clinical governance procedure.
Some of the initial results we've seen come out that have been published by the Department of Health show that the 111 service is referring about 60% of calls onto other providers, whereas the NHS Direct service refers only about 45%. Why do you think there are more calls being referred by the 111 service?
I think there is a similarity, in terms of what NHS Direct on the 0845 service does and what the 111 service offers as well. But I think that what the 111 service is getting is a different acuity of patients, so people that potentially are more sick because they're calling in the out-of-hours period rather than during the day. So one of the things that we are looking to is what's the right proportion of clinical to non-clinical staff in order to get the best outcomes in terms of referral rates for patients, but also for the broader NHS.
Okay. Do you think these statistics, the referral statistics, have an indication on the value for money of what the NHS 111 service will provide?
I think it's one of the factors in terms of overall value for money, but actually there are other factors which are equally important. So it could be in non-111 areas that a patient has had to speak to multiple providers in order to end up within the right place. In the 111 scenario, they speak to an organisation or a provider in order to get to the right place where they need to. So there's less duplication in a 111 system.
Okay. NHS Direct has said its main strategy is to become a significant provider. Why do you think you can be the best provider or one of the most significant providers?
I think that we have experience of delivering remote assessment using across multi-channels. We've got 12 years pedigree of doing that. That's our core business. That's what we think we're very good at. We also have the scale to enable us to be able to flex to the needs of the 111 service, which we think will generate more calls than the combined number that are going into NHS Direct, out of hours and ambulance trust at the moment, because it's a free to call, easy to remember number. So we think that we also have the really excellent clinical governance that's going to be required in order to make sure that this service, when it's delivered, is done in a robust, clinically assured way as well.
Okay. All right. Thank you very much for joining us, Ronnette.